Vaccination in nephrotic syndrome. Infection is common in nephrotic syndrome. The pneumonia, influenza, and varicella, measles. There are the plenty of other infectious diseases. They are the concern. So the killed and inactivated and the subunit vaccines are not contraindication. Live vaccines are contraindication when someone is on steroid therapy and other immunosuppressive therapy because the vaccine will be less effective. Thereby, it's important to know about the vaccination in nephrotic syndrome. So usually when we give the prednisolone 2 milligram per kg per day for more than 14 days, you have so-called the high steroid amount, so you do not give vaccines during that time. But when patient is in the alternate daily prednisolone, even less than 14 days previously, you can give the vaccine after immediately stopping the prednisolone if you need it, and the low dose less than 2 milligram per kg or total dose less than 20 milligram you can give during your prednisolone therapy or no, because it is not that high and you can response may not be that blunted. So when patient has cyclophosphamide, it's a little bit of a stronger so-called immunosuppressive, you can wait safely. You should wait 3 to 6 months of cyclophosphamide before considering vaccination in these children. When you have used the rituximab, you can wait for 6 to 9 months because it takes 6 to 9 months for the blood level to be cleared of the rituximab. So thereby we should wait and then postpone and hold the vaccine and then give it. And household contact persons, immunocompromised persons, should not have only oral polio vaccine. It's a live vaccine which may be transmitted from from one child to the immunocompromised child, nephrotic on steroid and other immunosuppressives. So don't do that. And Bangladesh immunization schedule says pentavalent vaccine, that means DPT 3 doses, hepatitis influenza B virus infection, hepatitis influenza B infection, and your hepatitis B virus infection. We give 3 doses in your 1.5 months, 2.5 months, and 3.5 months respectively. And then we also give the PCV, your conjugate vaccines of pneumococcus to the child, and we give 1 dose of the intramuscular polio vaccine. So these are the dose schedule like, and we give at 9 months the MMR vaccine. So apart from that, everyone should give it. And apart from that, you should give your child to more than 2 years of age your polysaccharide vaccine, 1 shot. And high risk patients like nephrotic, frequent relapsing sort of things, dependent sort of things, and you should give for after the 3 to 5 months second booster dose. And child who didn't have this, or who never had this vaccine, you give your PCV 13 another conjugate vaccine for 1 shot at least below 5 years of age, because it is effective vaccine below 5 years, and which is not the case with your conjugate vaccine, your 23. So it works after 5 years or 2 years. That's why you give it after 2 years. And annual influenza vaccinations below 8 months age children, you give 1 shot. After 1 month you give second shot, and then give monthly until you feel like this risk is there. And above 8 years you give 1 shot, and every year 1 shot, because influenza virus, they change their your antigenicity, shift and drift, and you need to change the annual vaccine pattern, antigen pattern, antibody pattern, and it comes globally, and you give it as per your market availability. Varicella vaccine should be given also. In the 1 shot of varicella vaccines, give antibody quite a long, and you give 2 doses. In Western schedule, they give it after 15 months. We give at 9 months, and second shot should be given. They give it another shot, after 1 to 2 months. And hepatitis vaccine should be accelerated schedule in pediatric nephrotic syndrome cases. That means 0, 1, 2 should be the protocol like in the nephrotic cases, and other vaccinations whenever they are available, they should be given, because these viral infections, bacterial infection, they have some role in the underlying pathogenesis of the nephrotic syndrome.